My name is Stephanie Stocks, and I am a graduate student at Arizona State University studying family and human development. Today I'm going to be talking with you about pediatric anesthesia. Specifically, we're going to be talking about the potential risks for children and discussing solutions to help minimize these complications. In recent years, members of the community have begun to take more of a stance on educating themselves regarding medical interventions, practices, and medications that are given to themselves and their children. For instance, a current debate that has been seen in the media involves parents and government officials advocating for the right to choose whether or not to vaccinate their child. Another growing area of interest, which has not been publicized as much but is just as significant, is the growing rate of pediatric anesthesia that is being used on children both in and out of surgical procedures. As data becomes available and research studies continue to develop, this topic continues to grow into a major public health concern. This presentation, as I mentioned, will focus specifically on the implications of pediatric anesthesia on children. Specifically, we're going to look at the physical, emotional, and behavior implications that it has. Additionally, I will talk about suggestions for how to reduce the unnecessary risks of anesthesia by using other therapeutic resources, including the use of child life specialists during medical procedures in the hospital. As mentioned, focus and concern has risen dramatically regarding the safety of anesthesia use for infants and for children. Recent collection of data indicates that an average of 6 million children per year receive some form of surgical anesthesia in the United States alone. From this staggering number, only 1.5 of those children are receiving anesthesia as a result of an inpatient procedure. So why is anesthesia being used so prevalently? Doctors, dentists, and many other medical professionals have found that anesthesia aids greatly when working with children in a medical setting. In a surgical environment, anesthesia provides amnesia, analgesia, immobility, and control of autonomic responses during surgical procedures. More specifically, in the non-surgical setting is where anesthesia has continued to grow. Anesthesia is used in these settings to provide safe conditions for everyday interventions, imaging, and diagnostic procedures by calming children as the procedures are done. Additional benefits to the child can include alleviation of pain, anxiety, and maintenance of their vitals. Due to the number of benefits for both in and outpatient procedures, an exponential increase is occurring in more settings, and a larger age range is being seen for children who are using anesthesia. The problem is the first area of focus that we're going to be discussing. Specifically, we're going to talk about the risks associated with pediatric anesthesia. While the benefits of anesthesia are relevant and can easily be understood, it is important to consider all factors regarding its use. In the preliminary stages of research on this topic, animal studies were conducted to see what effects anesthesia had on rhesus monkeys, rats, and mice. It was reported from these studies that neurotoxicity in the developing brain led to abnormal attention, learning, memory, and social behaviors. Though researchers understand that animals have slightly different genetics and maturation rates from humans, there is enough of a correlation among species to raise concern and bring new awareness to this growing situation. Understanding the potential risks, the American Society of Anesthesiologists began examining malpractice claims in 1984 to compare pediatric and adult cases related to anesthesia use. Examination indicated that nearly 33% of the claims filed resulted in patient brain damage or death. With such severe scenarios reported, additional studies began to form. In 1994, the Pediatric Perioperative Cardiac Arrest Registry began a study which involved 63 North American hospitals over the course of 4 years. This study specifically focused on pediatric patients who were under the age of 18 and who experienced a negative physical outcome related to anesthesia. During the 4 years, 150 cases out of 1 million treatments were reported. The average rate was 1.4 per 10,000 anesthetic medications given. Problems reported ranged from toxicity of halothane, which is a medication used in anesthesia, to venous cannulation, laryngospasm, hemorrhaging, and death. Researchers found that the likelihood of implications was increased when patients were under the age of 3 and had an ASA, also known as the American Society of Anesthesiologists, score above 3. This suggests that they were more prone to illness. Despite the relatively small numbers found in this study, it is important to recognize and consider that each child's life matters greatly. Placing them at unnecessary risk has the recorded potential to result in drastic lifelong implications. In addition to better understanding the physical complications that anesthesia poses, many researchers have focused on the psychological impact that it can have on children both in and out of the hospital setting. Results from many studies have suggested that hospitalization and anesthesia can have a substantial psychological effect on children. One study which clearly indicates that there is an emotional risk related to anesthesia use was conducted by the Royal Children's Hospital. In this study, 1,258 children ranging in ages from 3 to 12 were followed as a cohort study group, the only criterion being that they were having a procedure within the hospital that required general anesthesia. A smaller group consisting of 65 siblings who were not undergoing treatments requiring general anesthesia were selected to be in the comparison group. After the procedure, the anesthesia treatments were given, and each cohort child's emotional behavior was tracked using the Vernon Post-Hospitalization Behavior Questionnaire, which was based off of a 4-point Likert scale. This assessment was given by the parents of the child at 3 days and at 30 days post-operation. Likewise, the parents gave the same assessment to siblings who were part of the comparison group. Taking possible factors as socioeconomic status, prior hospitalization experiences, and temperament into consideration, results indicated that there are clear emotional risk factors associated with anesthesia use. Of the 1,258 children who were given anesthesia, 1,027 showed at least one emotional change during their procedure or after their procedure. Of more significance, 24% of children in the study group had 7 or more negative emotional changes at 3 days post-operation, with 16% still experiencing symptoms at 30 days post-operation. Negative changes reported included anxiety, behavioral aggression, apathy, withdrawal, and separation anxiety. Another noteworthy study to look at was conducted by the Department of Anesthesia at Asyut University in Egypt in 2015. In this study, researchers wanted to focus on the impact of anesthesia in younger patients. Specifically, they focused on children ages 1.5 to 5 who were involved in the same-day surgery procedures. Overall, there were 70 children involved in this study. 35 of these children had never undergone anesthesia treatment and were regarded as the control group. while the remaining 35 had 2 or more prior experiences with anesthesia and were considered part of the study group. Each group received anesthesia treatment 20 to 30 minutes prior to having their procedure done. They were then evaluated by parents before and after the procedure using the Child Behavior Checklist. Results from the study found that children with repeated anesthesia were at risk to become anxious or depressed, to have sleep problems, and attention problems. Additionally, researchers found evidence suggesting that even a single exposure to anesthesia at an early age can be indicative of long-term attention problems and cognitive impairment. In gathering the information from these studies and considering it in our minds, we can ask ourselves, what is the big concept of this information? As previously indicated, anesthesia has significant benefits when it is used for difficult or invasive medical procedures. However, as we have also noted from the research studies discussed, there are clear physical, emotional, and behavioral risks associated with anesthesia. Though some studies indicate only a small number of children are affected from procedures involving anesthesia, other studies indicate much higher numbers. Regardless of the statistical data, however, it is important to recognize that even a small percentage is still associated with risk. Eliminating this unnecessary risk for non-invasive procedures is not only ethical, but imperative when considering that each number represents a child's life. Considering this, are there effective ways to limit the risks associated with anesthesia while still ensuring that routine medical procedures are conducted efficiently? The answer is yes. There is a solution. Researchers have found that there are several therapeutic interventions which can be implemented in a hospital setting to help reduce procedural risk. A professional who is highly trained and specialized to implement these therapeutic techniques with children in a medical setting is a child life specialist. They offer unique therapeutic techniques that are very imperative for hospitals to consider. While the career of a child life specialist is fairly new in its title, they have essentially been around for many years. Child life specialists are professionals specifically trained to assist children and their families in navigating and adjusting to pediatric healthcare experiences. Their training begins during their undergrad and master's programs, which are taken with a specific focus on child life and family relationships. In addition to taking several courses focusing on familial and educational concepts, these child life specialists undergo an intensive 480-hour internship where they learn through hands-on experience which types of interventions are the most effective, how to individualize services to a child's needs, and how to act as a mediator for families and for medical professionals. Typically, their work occurs in hospitals where they can help to educate patients and families, as well as work to reduce anxiety by implementing various developmentally appropriate interventions. These specialists can also provide services outside of the hospital, including in outpatient clinics, dental offices, and counseling centers. Essentially, they are a nurse, a therapist, and a friend in one. As mentioned, child life specialists are unique in that they offer a wide variety of therapeutic strategies, both in and out of the hospital. These strategies, which are selected, are largely dependent on the specialist evaluation of the child and their family support system. The evaluation, which occurs through initial observation and following discussions, focuses on the child's physical, cognitive, and emotional readiness based off of different developmental models. Once a specialist understands where the child is at in each of these areas, They focus on understanding the child's support system, their prior experiences in the hospital, and their most immediate needs relating to the procedure or illness which they are experiencing. With better understanding of the child as a whole, these specialists select an appropriate therapeutic technique to aid with better understanding of the procedure or illness, methods for how to cope during the procedure, and practices for remaining physically, emotionally, and mentally strong during and after the procedure. A few of the most popular methods to educate and relax children during all stages of their hospital experiences include positive imagery, distraction using toys or electronics, modeling of the event, medical play, art, music, comfort positioning, and massage therapy. While many therapeutic techniques can occur in an operating room, at a child's bedside, or in outpatient areas of the hospital, other practices can take place within the hospital playroom. Not every hospital has a playroom, but they are becoming more prevalent as awareness of child life specialists grows and are often found in larger hospitals throughout the nation. This is especially an important area for children who have long-term stays in the hospital. In the Child Life Playroom, a safe environment is created. A child life specialist and their team members have the unique opportunity to create individualized or group activities for each child within the pediatric unit. These activities are always created to be developmentally appropriate and to facilitate coping strategies. Examples of activities that may occur within the playroom include painting, medical, artwork, playing musical instruments, journaling, reading a variety of texts, playing a video game, playing a board game, engaging in free toy choice, and having a special visitor come. These visitors can range from celebrities to local heroes to friends and family. Regardless of the activity, the room layout, or the prevalence of materials, each hospital playroom offers children an opportunity to play through the experience of their hospitalization within the presence of a caring and supportive child life specialist. As mentioned, there are many therapeutic strategies which can occur both in and out of the hospital setting and playroom. Outside of the playroom, the types of services utilized by child life specialists can vary greatly depending on the patient's age, the procedure being given, and the developmental needs of the child. The benefits of these therapeutic services remain consistent for all children. By teaching pain management techniques, emotional responses, and coping behaviors, a child life specialist not only supports the child before and during a procedure, but also teaches them techniques for how to remain positive and healthy after the procedure. In addition to offering pain management and healing services, child life specialists understand family dynamics and can effectively build relationships with the families and the patients. The trust established in these relationships helps child life specialists relay information to each family in a sensitive way that is unique to their educational and cultural needs. Additionally, this relationship, which is built on trust, supports family members as they express questions, concerns, and perceptions of the medical actions taking place. Acting as a liaison between the family and the medical staff, a child life specialist can help families and the medical team work together to find a solution that is accepted by all members involved. Since patient satisfaction is an important measure of the quality of health care, hospitals should highly consider using a child life specialist to work with family members and patients during the course of their medical procedures. To better understand the effectiveness of a child life specialist and their services in a medical setting, a recent study was conducted by Banster and his team. In this study, the researchers worked with 678 certified child life specialists from across North America. A survey was then given to each of these specialists asking them to rate their usage and the perceived effectiveness for a variety of non-pharmacological strategies. The team found that 65% of child life specialists reported using at least one type of therapeutic pain management technique with each patient that they visited with. On average, specialists rated the effectiveness of these strategies as a 3.6 on a scale from 1 to 5, indicating successful implementation. For patients who did not require pain management techniques, child life specialists reported using cognitive and behavioral strategies, positive reinforcement, therapeutic play, and reassurance to work with children and their family members. Overall, the survey results suggested that child life specialists are actively involved in pediatric pain management and are using a wide variety of non-pharmacological techniques, which are supported by research literature. There are many reasons to incorporate a child life specialist or a child life specialist team into a hospital setting. Through their educational training and hands-on experience, child life specialists have a unique understanding regarding how to work with patients, their families, and other medical professionals in the hospital. They conscientiously look at each patient's needs and development, and then they make meaningful plans to work with them before, during, and after a procedure takes place. Prior to a procedure, they work to educate, teach coping strategies, and to use medical play to help relieve anxiety and prepare children for upcoming events. During a procedure, they effectively use toys, books, videos, games, and therapeutic methods to help children remain positive and focused on something other than the procedure. Afterwards, they help to reduce behavioral and emotional repercussions by following up with patients to clear their misconceptions, review recovery methods, and ensure that the needs are met. This helps with their psychological recovery immensely. During all stages, the child life specialist offers guidance and helps the patients as well as their families feel supported and cared for. Unlike traditional medical procedures, which require the use of anesthesia and can leave the patient with emotional, behavioral, or physical pain, child life specialists offer a natural solution. They are there from the beginning to the end and strive to leave the patient healthier and happier than before. I strongly suggest looking into the use of child life specialists in your hospital setting. They will change the environment and make it a more positive one for patients, their families, and for the medical staff. They really are a liaison between all three. Thank you for listening to this presentation and considering the importance of this medical topic. If you have any questions, please feel free to ask me, and I will gladly address them.